Hello, everybody. Good morning and welcome to this webinar towards a European Health Union, a Breathe Vision for the Future. And this is an event hosted by the European Parliament Lung Health Group. My name is Tamsin Rose and I have the great pleasure to be your moderator for this morning. Just to give you some of the housekeeping rules so that we understand how today is going to work. All participants are muted to make the best of our user experience. If you would like to engage, please use the chat function that you will find at the bottom of the screen. Please don't spam the chat so we can use it for content related of this webinar. After the event, there will be a report, and this event is being recorded and will be shared on the YouTube channel of the different organizations and the MEP Lung Health Group. We're here today because there's a document being launched. It's the Breathe Vision 2030, and you will already find that it's available on the website breathevision.eu, and you will have a chance to read more about it, get the background, get some of the data and the statistics. This morning, we will take you through the document. We will share some of the highlights and opportunities for people to understand the context. If you would like to tweet and on social media, we encourage you to use the hashtags you can see on the screen. That's Breathe Vision and MEP Lung. These are the two social media hashtags that we're using for the event. Let me now share with you the program, and I'll take you through what we're going to be doing today. So, of course, I'm providing the first opening and the welcome, and then we have two members of the European Parliament who will be providing their context and their welcome. And of course, this is an event that is linked to the Lung Health Group in the European Parliament. Then we'll be having two interventions, one from the European Commission, Mr. Pierre Delsaux, Deputy Director General for Digisante, and we'll have Jill Farrington from the WHO Euro, who's in the Division of Non-Communicable Diseases. Then we'll have two of the leading organizations behind the Breathe Vision, the European Federation of Allergies and Airways Patients, the President Michaela Odemir, and the past President of the European Respiratory Society, Thierry Troosters. Then what we're going to do is we will give you some of the background and the content of the Breathe Vision document. We have a fantastic roundtable. Each of our speakers will give you insight into one of the 5 main themes of the report, and that's when we'll have a Q&A with you, with the audience. So if you have a comment or a question, that's when we'll be coming to you and bringing you in, and you'll be using the chat function. And then we'll have closing messages from the chair of the European Lung Foundation, Kield Hansen, and also from MEP Željana Zovko and MEP Sean Kelly. So that is going to be the program and how it's going to work. We can now go ahead, and I'd be delighted to hand over the floor to the MEPs who are our co-hosts for today and in relation to the Lung Health Group. So let me first invite MEP István Ujhelyi to give us our welcoming messages. István, the floor is yours. Please go ahead and unmute yourself.
Thank you so much. Good morning. Good morning. I tried to fix my camera at home. It's very difficult to work from my home office. I can see my dear colleague Željana, who is in the parliament in Brussels, but I'm in Budapest this time with my kids. It's not easy, but to travel is terrible. You have to know that the last 1 hour I had another meeting because I'm a special ambassador of the UN World Tourism Organization, and we had a discussion about the reopening of the tourism industry and the service sector. It's very difficult because in one hand, I try to serve the tourism and the tourists and those workers. And on the other hand, of course, I try to have a bigger fighter for the health. Sometimes it's very difficult to serve the same. But today, I think it's very, very, very kind for me to be together with you, dear participants, dear organizers. So first of all, I would like to thank you for the opportunity to be here with you today. And I would like to thank the organizers that this event could happen. Please allow me to extend a special welcome to a participant who is also Hungarian, Mr. Gergely Mészáros, who is representing the PHA Europe. I would be more than happy to hear his talks among the others. But as you know, as Tamsin Rose, also, I think you have to know that, unfortunately, immediately after our speeches, I have to leave this event after my opening speech because of a shadow meeting will be in the parliament and I have to be there online. Back to November 2020, when the European Respiratory Society asked me to host an event in January, it was not a question for a second to say yes, because for me, it's relevant to share my thoughts about the importance of the European Health Union wherever I can. More than 2 years ago, before my second term and much before of the COVID-19 pandemic, I have decided to focus on the healthcare. I did it so because of the healthcare system situation, for example, in my country, Hungary, and because my parents are doctors, so healthcare was part of my day-to-day life. Together with healthcare experts, we have made a consultation in Hungary, and it became clear that most of Hungarian people want better healthcare, stronger patient safety, more patient-centered service, and thoughtful prevention. Then the COVID-19 pandemic came and subverted our life, and the rest is history. But with the pandemic, an opportunity came, the opportunity to create an European Health Union. I have to tell you that I'm extremely proud that my political group, the SD group, was the first who recognized the importance of the European Health Union and created this brand and supported the implementation of it. We fought it in 2020 for the health budget, which is 12 times bigger than in the past 7 years. And the end of 2020, the Parliament approved the EU for Health program. And the EPP and all the big pro-European groups supported it, and we could created it together. And it's a big historical result, I think, for the European health future. We don't have time, I don't have time to tell you all the goals of the EU for Health program. You can check it, but I really hope that it will change our life in the European health structures. We can connect the dots, and here comes the initiative of Breathe Vision 2030, which is very unique. This is the first time that European level patient groups and healthcare professionals came together to produce a vision, a complex idea which aims to increase awareness of respiratory health, improve lung health care, and research and tackle COVID-19 and its long-term impacts in Europe, involving 190 members associations across EU and non-EU countries, and give a voice to 500,000 lung patients and 40,000 health professionals. Non-communicable diseases are a result of a combination of genetic and health determinant. These diseases, as you know very well, much as cardiovascular, the chronic respiratory, diabetes, and neurological disorders, represent major causes of disability, ill health, health-related retirement, and premature death in the Union. The Union and the member states can reduce the burden of the national healthcare systems by working together to achieve a better and more effective management of diseases such as respiratory diseases. The EU will support actions and in this area, just as the development of specific European preventive and disease management guidelines in the area of both communicable and non-communicable diseases. I honestly believe in prevention, awareness, and public information. These are ideal ways to save money in public health. So dear colleagues, there are several issues where we can work together. I have a good friend, Csilla Mezősi, from the SPY Association. She also pushed me to try to connect your network and the medical health tourism issues. I hope we can find the best solution for our nations. Thank you for your attention. And so sorry, I will leave later to the shadow reporter meeting, but I will serve you from the parliament. Thank you so much.
Thank you very much, MEP István Ujhelyi. It's extremely helpful and inspiring to hear someone with such a clear message and a focus and explaining why health is something that you understand is both important to your constituents in Hungary and has a relevance at European level. Let's stay with the European Parliament now and hear another message from MEP Željana Zovko, who is from Croatia, another member of the MEP Lung Health Group, and another person who's made a strong commitment to supporting health at EU level. Željana.
Right. Hi.
Hello, lovely to see you.
Lovely to see you too, and it is a great pleasure to see you and to see my colleague István in Hungary. Hi, warm regards from Brussels, rainy Brussels, and as you can see that we are really having multiple tasks at the same moment. We are juggling in the different conferences and the committees, so I just had to ask the questions in the Committee of Defense. Yeah, but this event is of utmost importance, especially during this COVID time. And I I thank you so much for organizing it, for promoting it, and for having me as well. Letting me to take part and to contribute in my capacity as a member of European Parliament. So I am delighted to co-host this great event and to launch the Breath Vision 2030 paper. As a co-chair of the MEP Lung Health Group, I would like to thank all those involved in the drafting of the paper for their outstanding efforts. The paper offers many interesting proposals that would render European Union more healthy and more patient-friendly. Already before the pandemic, Europe counted over 600,000 deaths a year due to respiratory diseases. And as we all know, the COVID-19 pandemic has increased the healthcare and economic burden, and it has shown more than ever that we need to promote lung health. With the MEP Lung Health Group, we aim at maintaining a forum for discussion with the stakeholders. We promote an understanding of the risk factors and support the translation of this dialogue into policies. The paper that will be presented today sets a big step in the right direction. I look forward to hearing the ideas from the roundtable discussion on improved prevention policies and how we can make European Health Union more effective. And dear Ms. Rose, thank you so much for your excellent moderation, and you're always so smiley and so warming and welcoming that it's a real pleasure to start today with you. Thank you so much, and I wish you very, very good discussions and good contributions to this event.
Thank you very much, Željana, and it is always a pleasure to work with you. You've got such clear messages about how Europe needs to be taking the issue of health seriously. So there we've had two messages from the European Parliament highlighting why this is an issue that MEPs are choosing to focus on. And just to give you a sense of how how much this webinar is attracting interest, we had more than 420 participants register from 72 countries around the world. So clearly this issue of setting forward a long-term vision about how we could improve lung health and be able to breathe better is resonating with our audience. I'd now like to pass the floor to Pierre Delsaux from the European Commission, the Deputy Director for Digisante. This mandate, as István has mentioned, has got 12 times as much money as previous mandates have had. It's got the political support at the highest level from the President of the Commission downwards. There's no question that health is going to be one of the defining features of this mandate. And the Commission has announced a raft of very ambitious plans. So what would you like to share with us, Pierre, about what we should be looking for as new initiatives coming forward from the Commission in the coming years? Pierre.
Thank you very much, and good morning to everybody. First of all, I would like to thank the organizers, for taking this initiative, because it's very timely and it's a very important initiative. And I also would like to thank the European Parliament, because the role of the European Parliament in those discussions is key. And so we certainly, as a Commission, we certainly want to continue the cooperation with the European Parliament, but also with all stakeholders. So my first message to you is a very simple one. Thank you very much for your vision paper. I've read it. It's quite very, very interesting document. And I certainly look forward to hearing the debate and the discussion about it. But that's what we need, a real vision for the future, for something which is so important. So my second message is, of course, we live in difficult time because of the COVID situation. And we know that a lot of people are being affected, number of deaths, sick people, employment, economy aspect, and so on, which is fundamental. And so it's a very terrible crisis. But maybe one small positive aspect of this crisis is the focus which exists now on health. Everywhere in the world, we realize that investing in health, coping with the health situation is fundamental for the future, because we will be out of this crisis, soon, I hope so, but there will be other crises in the future. So we really need to invest more and to dedicate more time and resources in health. And as you say, for this Commission, for certainly my Commissioner, for my President, this is a top priority. We have no choice. Health should be the number one priority, because without health, you don't have an economy. If people are sick, the economy is dead. So fundamentally, we really need to invest and to do more on health, and that's something which is very important. That's why if I move to, the Commission vision on health and what we want to do in the future, I would like maybe to focus on what I would call medium-term vision and maybe just more short-term points, which are also extremely important. Medium-term vision. As you know, the Commission has adopted a European Health Union project. It's a very important element. Why is it important? Because what I really want is to have all stakeholders moving in the same direction to build a stronger health in Europe. And I insist on that word, in Europe. Because one lesson also of the crisis is the fact that we cannot, live only on domestic basis. We see the COVID crisis is everywhere. There is no borders. So if we want to work together in the health sector in the future, we need to work, all of us, with the same direction. So when you look at the health union that we propose as a Commission, we certainly want to reinforce the health security framework. We need to make sure that we have health systems in the different member states which are stronger, more adequate to cope with the future crisis. That's one very important element. The second element, which we believe, and that's probably a result of the COVID situation, we certainly need also to prepare for future crises. Crisis preparedness is something which is important. And as you know, as a Commission, we are considering to create a new authority, which would be called HERA. Of course, don't ask me what will be the exact mandate of this HERA, because that's still, work in process, and we will consult you on this. But HERA will be there to try to look at that aspect. How can we be better prepared for future crises? And of course, last aspect of this important aspect of the health union, let's not forget that we have two agencies which are already working well in Europe, the European Medicine Agency, ECDC. Both of them should stay in the future, but we need to look how to reinforce their role and to make sure they're also more adequately effective in the future. So that's something which is important. So first dimension, health union. Second dimension, second medium-term vision, pharmaceutical strategy, which lists a long list of measures that we want to cope which we want to cope in the health sector. We believe this is something which is important, and we certainly need to work all of us together in that direction. Third aspect, cancer plan. As you know, the Commission is going to adopt a cancer plan in beginning of February, so next week, actually, very quickly. And of course, if you talk about cancer, one aspect of lung health is something which is extremely important. Why is a cancer plan important? Because what we want to do with a cancer plan is just to give a holistic approach to this issue. So we want really to cope with all aspects of cancer, not only focusing on one aspect, but we want to cope with the question of, prevention.
Pierre, I'm sorry, you've gone on to mute. Could you unmute yourself?
Sorry, that, sorry, I was too enthusiastic and I touched a button which was not the right one. So I was saying that we want to give a holistic vision to in the cancer plan. We want to look at prevention, early detection, treatment, of course, and quality of life. So we really want to bring all the stakeholders, all the dimensions of that issue, which we believe is fundamental. And of course, having a cancer plan is important. What is even more important is to implement this cancer plan. So we want to be also ambitious in the implementation, and we want to move quickly. I will be very short for the rest because I know I don't have too much time. I would simply insist on two other points. Another point which has already been mentioned by the members of the parliament, which is extremely important, EU for Health. Again, EU for Health exists and will be a very ambitious program with close to 5 billion euro for 7 years. It's a lot of money if we invest it well. So we need to make the best use of this amount of money, all of us together. It's not for the Commission to decide. It should be a common work, common approach with all stakeholders, member states and the European Parliament. We need to use this amount of money to deliver things which are quite effective. But again, 5 billion is quite a lot of money and we can leverage much more money out of it. So that's something which is extremely important. One aspect, of course, which is important, and that would be almost my last point, tobacco control is an issue which is important. We need to see what we can do with respect to tobacco. And certainly the objective to create a tobacco-free generation is certainly something which is clear to the mind of the Commission. And so we need to see how we can work in that direction. And my last comment, and that's something which is important for lung, and it's not directly linked to health. But as you know, one of the two priorities of this Commission is also a more green Europe. If we fight the pollution, if we address the issue of environment, this will have also very positive consequences on health and especially on lung health, but not only. So let's not forget that dimension where all of us as citizens are concerned to make sure actually that we fight and we are much more effective in the future. So I look forward to hearing the different comment, reaction and so on. But again, thank you very much for organizing this and also for chairing this meeting and animating it. Thank you very much.
Thank you very much, Pierre. And I appreciate you setting out for us very nicely there the big initiatives and opportunities that exist with this mandate. I appreciate again that the EU for Health is still at the very early stages, and the proposals for the new HERA and the updated mandate for the ECDC and the EMA are still a work in progress. But can you give us any insight about what we could expect from the EU for Health program in the area of respiratory and lung health?
But as I say, the EU for Health program, EU Health, you have two aspects. EU Health Union is something which is important, and as you say, I don't know, of course, what's going to happen with HERA and so on. But clearly, the issue that we want to address with HERA is the issue of how can we better detect the problems in advance. What can we do to detect a future crisis which are going to happen? And that's something which we believe, and of course it could be also in the lung, with respect to the lung health, because those kind of issues are extremely important. So we need to use HERA to have this kind of work. Second aspect also, detecting is important. What do we do once we have detected possible crisis arriving in the future? What can we do? What kind of instrument will be there? So that's something which also we believe will be important to look at. But again, I don't want to anticipate, because one lesson I've learned from my past, as bureaucrats, we are not there to dictate, everything to the rest of the world. We should be there actually to listen to stakeholders, to those who are really on the ground, who know best than us, and we should really have a proactive way to create ERA. So my vision of creating ERA will be, I want to listen to you. I want to be there with you, to understand what are your concerns, what are your suggestions, and how together we can build something which will be really useful for our citizens in the future.
Thank you, Pierre. That's going to be extremely useful to our audience, because I know we have amongst the 400 participants who've signed up, both clinicians and patient groups who are looking for ways that they can engage. Is there anything you can tell us about the time frame or the process for consultation? Because you said you want to listen, so that means perhaps there's going to be a consultation or a stakeholder engagement process. Do you have any details of that?
On ERA, it will be extremely quickly, because we are already going to produce, publish, probably at the end of this week or beginning of next week, already a document which is called Inception Impact Assessment, which is just a basic document, giving already the orientation that we want to discuss, and it will be already a first opportunity for citizens and stakeholders to consult. But again, whatever formal publication and we do, my door is virtually open. So in other words, don't hesitate to contact me by mail, by whatever means, and give me, and we can organize also meetings and so on. Because again, I want this process to be as inclusive as possible. I want this process to really include everybody who has something to say in this. Because again, if we want to succeed, it's only by working together that we'll be able to succeed.
Thank you very much for that open invitation. I'm sure there are many participants in this audience that will be wanting to take up your invitation and engage with you on this. So thank you very much for being with us today. I'd now like to pass to Dr. Jill Farrington from the WHO Euro region. She works in the Division of Country Health Programs and is a regional advisor with specialization in non-communicable diseases. Jill, let me pass the floor to you to share a vision, what's happening a little bit in the wider European region on this issue of supporting lung health. Jill.
Thank you very much. I hope you can hear me okay as I'm here.
Yes.
Thank you so much for the invitation, and we join with colleagues in welcoming the initiative. I was very pleased to see the Breathe Vision paper and what was contained within it. I bring the greetings from colleagues in the European Office across multiple programs who are working on the issue of lung health, also in partnership with the European Respiratory Society, amongst others. Within Europe, we're seeing a really mixed picture in terms of lung disease and the risk factors. In terms of the positive side, we're seeing that the achievement of the Sustainable Development Goal on reducing premature mortality by 1/3 for non-communicable diseases by 2030 is actually progressing well, and we expect to achieve that target for Europe as a whole. For tobacco epidemic, we're on track in terms of reducing the incidence and the mortality in tuberculosis. But on the other hand, we're seeing big differences between the east and the west of the region, and in particular diseases. For example, lung cancer incident rates are rising, particularly in the EU member states. Air pollution is linked to over 500,000 deaths in Europe. Tobacco use rates are amongst the highest in the world. And many of the progress that we see is threatening to be derailed by the effects of the COVID-19 pandemic. We just take disruption of services, for example. A survey by WHO last year showed that 59% of countries had partial or complete disruption of asthma services, and 60% of countries had changes to TB services and reductions in facilities. In terms of our overall approach in WHO, it's framed by our European Programme of Work, which is United Action for Better Health in Europe. So just by the language, it's anchored in partnerships. It's sharing the global priorities of moving towards universal health coverage, protecting against health emergencies, promoting health and well-being, accelerating impact in countries through stronger health systems, and also specific flagship initiatives on work such as immunization and digital health. This broad approach of WHO on lung health is cutting across multiple programs and is comprehensive. As we heard, prevention, screening, treatment, end-of-life care, communicable diseases, non-communicable diseases, and across the life course. If I just pick out a few of the initiatives that we're working on, the European Office, the Center for Environment and Health of WHO, is updating the global air quality guidelines, which will be published in mid-2021. It's also gathering together parties of the Air Convention for the United Nations European Commission for, Economic Commission for Europe. And it's also supporting countries in quantifying the health impacts of air pollution. Tobacco control, we're working with countries to strengthen implementation of the Framework Convention of Tobacco Control. Tuberculosis control, we've been implementing the Tuberculosis Action Plan for the European region. In the area of screening, we're working hard with countries to improve the quality of screening program and their effectiveness, and this includes newborn screening, particularly including for cystic fibrosis. And then in care, we're trying to improve the quality care through multiple ways. I've mentioned universal health coverage, improving access to medicines, and also in improvements in palliative care. So across multiple programs, WHO is active in promoting lung health, and learning from what COVID-19 is teaching us, we need to be also strengthening our health systems built on primary health care, embracing digitalization, and also taking account of the environment and climate considerations. So joining with you, we would look forward to building the stronger lung health in Europe and this united action. Thank you.
Thank you very much, Jill. And you've given us a real sort of overview of what's happening in a range of different issues. And you've highlighted again that pre-COVID, we already were seeing high levels of death and mortality and morbidity in Europe linked to lung diseases, from whether it's pollution and ambient air that we could do something about, to genetic causes, so you're looking at newborn screening, to the more classic areas where we still need to make huge progress around tobacco control and elsewhere. So you've given us a very broad range of issues, a TB action plan amongst others, an insight to what's happening in the WHO region. And thank you again for reminding us that Europe is more than just the EU, where there are 53 countries in the region with all that need to make progress and move ahead. Okay, thank you very much, Jill, for your time. We're running a little bit late, so we won't take any questions, but I'm sure if people do have questions, we can forward them to you later to see through that. And this event is recorded, so all the data that you've provided will be available to people. I'm now going to go ahead and move to the next section of our program, because we've got running a little bit late. But now let me please, we're going to have a poll that we're going to ask. We'd like to ask the audience. We've heard from the European Commission, they've got big plans coming up, and they are launching their first steps towards the European Health Union. What do you think this might bring? So we've got a poll on screen now, and we're going to hold it open for about 45 seconds. So you are allowed to choose as many of these options, but what do you hope this might bring? We've heard about the ambition, we've heard about there's new political focus, there's a larger amount of money. What do you think we should be able to deliver with this? So you can check as many of these as you'd like. And when you've chosen the ones you want, you hit the submit button, and we'll just keep this open just for another few seconds. And then we will be showing you the results. And we have 200 participants attending our event today. So we've got an opportunity to get some real insight from what our audience wants. So let's close the poll now. And here we can see the results, that the top thing that you would like to see is information and best practice across the EU, followed closely by disease prevention, better healthcare outcomes, greater EU interest in health research, and a better response to health threats. Yeah, we've had a question in the chat, is this limited to the EU? It is, in the sense that the European Health Union is an initiative and a program of the EU. So it's setting out the new ambition for what the EU would like to do with its member states. but as it's a very significant part of the whole European region, everything that happens at EU level has an important spillover effect in terms of political impact, and there will be opportunities for other countries usually to participate and support. So thank you for that poll. That gives us a strong idea. Information and best practices is coming through as the key thing you'd like to see. And in that aspect of best practices and information, let me now move to the next speakers on our program who are going to give us some more insight into the Breathe Vision 2030. As we've heard, it was a multi-stakeholder process. It was a careful process of understanding, what people were expecting from across the stakeholder range in this area. And there are two people who are going to give us some insight. We have Michaela Odemir, the president of the European Federation of Allergies and Airways Disease Patients Associations, and Professor Thierry Troosters, the past president of the European Respiratory Society. So let me start with Michaela. Go ahead and take us through the context of the Breathe Vision.
Thanks a lot, Tamsin, and thanks everyone for joining us today. I am delighted to welcome you to this special event. Today we mark a major milestone for the European lung health community, the launch of the Breathe Vision for 2030. Since last winter, we have all witnessed how COVID-19, a respiratory infection, has caused the death of more than 2 million people worldwide, and bringing the healthcare system of many countries to the brink of collapse. Even when mild COVID patients have experienced what it is to be out of breath, to suffocate, to be at the mercy of your lungs. This is what chronic respiratory patient feels when their diseases lacks proper care. More importantly, the virus shows how vulnerable we all are and how fragile our lungs and airways are. It is time to take the care of lung health. The Breathe Vision for 2030 is a result of a hard work of the European Lung Health Group, an informal cooperation launched in 2020 that for the first time brings together all European level respiratory patients and professional groups. Together we have a membership of 500,000 respiratory patients and 40,000 health professionals in 36 European countries. Chronic respiratory diseases are a great threat to human health. 1 in 8 deaths in the EU are due to lung diseases, and this was before COVID-19 hit us. For example, in asthma and COPD, diseases that I know best, around 30% of asthma and COPD patients visit the emergency room at least once a year, a figure that becomes over 50% in severe cases. This is unacceptable. Where there are many lung diseases, the solution in the Breathe Vision for 2030 will help us overcome them all. Next slide, please. Respiratory health deserves greater visibility at European level. This is why the European Lung Health Group has built this Breathe Vision around 5 priority areas for respiratory health. Those areas are: 1. Raise awareness of respiratory diseases. 2. Promote prevention policies. 3. Enable access to care. 4. Advance research. And last but not least, 5. Draw the lesson of the COVID-19 pandemic. Our visions serve a set of principles to guide the future European policies affecting lung health. And for each principle, we offer clear, achievable goals to be reached by 2030. But first and foremost, it reflects the common voice of patients and healthcare professionals, a joint call for action to respond to the unmet needs affecting millions of patients in Europe and all those at risk of lung disease. This is our roadmap for respiratory health, and from today, it is yours too. We invite all organizations interested in advancing lung health in Europe to endorse our Breathe Vision for 2030. And of course, we call policymakers to make it a reality. I am now glad to pass the floor to the immediate past president of the European Respiratory Society, Professor Thierry Troosters, who will guide you through the main opportunities brought by the Breathe Vision for 2030. Thierry, over to you.
Thanks, Mikaela, and thanks, Tamsin, for the kind introductions. It's my pleasure to present this. I'll be as quick as possible to hopefully save some time or get us some time back so we can have some discussion. If I could have the first slide, please. So I think we've already heard from Pierre Delsaux that although COVID-19 has caused a lot of trouble in many areas, there were also some opportunities, and for me at least, it showed that we were capable of responding quickly, and you can take that, you can criticize all this, but I prefer to look at the glass as half full. Europe came up with an EU vaccine strategy. We strengthened the European Centers of Disease Prevention and Control and started listening to them. We expanded the European medicines agencies, which allowed quick approval of very much needed vaccines, and accelerated research with massive investment in COVID-19 research, for example, that allowed solutions to problems. On the next slide, I think it's now time to translate what we've learned during the COVID pandemic and rapidly learned to further improve on that and accelerate this so that we can now start using these principles and this efficiency to actually achieve the 2030 Sustainable Development Goals. And if we then look at health, for example, what we've learned during COVID and what is described in the Breed Vision will then help to reduce the premature mortality from non-communicable diseases, for example. And it will also help us to better cope with pandemics as the one that we just witnessed. I think we have to work together with WHO and particularly WHO in the European region to do more country missions and disseminate also what is in the Breed Vision towards local authorities. Next. If you get the chance to read the Breed Vision, and I would definitely invite you to do so, you will see 5 pillars around which we have sort of built up the strategy. And many of these are actually quite well attuned with already existing European policies or even regional policies. And I will give you some examples. For example, around awareness, which is to basically empower patients and give enough attention to lung diseases, which indeed kills many European citizens. We can tap into the ECDC as a world-class disease prevention and control center, not only for infectious diseases, but perhaps also for non-communicable diseases. And we've heard already from previous speakers that there is an ambition to do so. In prevention, which is all around tobacco control, for example, and quality, European air quality guidelines, and also secondary prevention. Oops, now there is a bit too much on the slide. If you could go back. The Green Deal, for example, will lead to a better environment, and we are really willing to put our efforts to further promote this and make sure that this is known to citizens. And also in the EU for Health program, about 20% of the budget is directed to prevention, which I think is the best way to alleviate suffering from respiratory diseases. If you don't get it, you will not suffer from it, of course. In terms of right care, there is the EU pharmaceutical strategy, which taps in nicely to this pillar to make sure that people get the right access to care, are diagnosed timely, are not only diagnosed in wealthy countries, but all around Europe and perhaps even all around the globe. Patients get access to proper management of their diseases, not only pharmaceutical management, but also non-pharmacological strategies should get our attention. And obviously in terms of advancing research, and this is definitely something that is high on the agenda of the European Respiratory Society as a medical professional society, the Horizon Europe program and other programs around that will basically help us to make breakthroughs in lung health, and of course not only in lung health, but also in other medical disease, in other diseases. And we can do that as respiratory societies, but we like to collaborate also with other diseases, because typically also our patients suffer from different chronic diseases at the same time. Research is all around helping push research ideas, but also use the patient priorities to steer research a bit more. And I think this is also importantly reflected in our Breed Vision document. We also would like to stress that coherent collaborations and networks are very important to push research. So if you then see what we can do on the next tab in this slide, in each of these points, we can help to basically push forward these ideas that are already on the agenda of Europe or are already on the agenda of the WHO. We can put data to great use if ECDC helps us to collect them. For example, there is a European Lung White Book, which is nicely disseminated and gives a nice overview of the problems with respiratory diseases. We can use the networks that we have already, for example, in the ERN Lung network. We can promote health benefits with our partners. We can bring innovations to provide healthcare providers and patient input. So in each of these areas, we can basically help to push that through. And I think it's important to sit here, not really to criticize anything that happens in Europe, but really to offer our help to push European policies forward. I think we have to do this together. On the next slide, there are some other examples of how existing ideas and policies already tap into the Breathe Vision paper, for example, around digital health, for example, around Europe's Beating Cancer Plan, which we wholeheartedly endorse, and around the HERA, the New Health and Emergency Response Authority. I think we can definitely help to push these initiatives forward, as they are important and they are also in sync with the Breathe Vision that we launched today. Next slide. So I think the Breathe Vision is basically an inspiration. It's not something that comes out of space. It's really something that sits within the existing initiatives and networks. We can work together with policymakers and facilitators, and that's actually what we are doing here in this MEP lung health group. We like to reach out to politicians within the network of the European Respiratory Society and the other societies involved in this project, not only with policymakers, but also with regulators, with healthcare providers, patients, and also importantly with the industry. So we hope that all these stakeholders take a look at this Breathe Vision and provide us with input so we can further build on the future for respiratory health. Thank you.
Thank you very much, Thierry and Mikaela, for giving us a background on, how the Breathe Vision was developed and where you see the crossover with the many bold initiatives and financial plans that the European Union is putting on the table, and there is a great synergy of making things come together. And I think it's important to remember that one of the big lessons of the COVID-19 pandemic is that when we have underlying conditions in the population, whether it's asthma or COPD or other things, that makes us all more vulnerable. So one of the key areas of building our resilience as a society is making sure we can ensure better health for the now, so that we are better prepared for future threats. So thank you very much to both Mikaela and Thierry. We're now going to have the next session, which is going to be a roundtable discussion of different participants and stakeholders who will highlight each of the 5 key themes in the Breathe Vision 2030 document. And you should see in the chat the link to go and download the document. Please go and explore that website, have a look at it. That's also where the event report will be and the recording of the session if you want to hear it again and learn more about it. So the first person I would like to introduce, who's going to give us some focus on awareness aspects, is Ujhelyi Mesharos from the Pulmonary Hypertension Association of Europe. Ujhelyi, talk to us about awareness.
Many thanks, Tamsin, for your question, and also István for your kind words. Actually, when you look at the shocking number of deaths due to lung diseases, the loss of quality of life that researchers measure as disability-adjusted life years, or the cost created by lung diseases, it is quite shocking. It is obvious that action needs to be taken without delay. The facts explaining the impact of the COVID pandemic show there is a huge need of reliable information and better understanding of lung diseases. Lung health has been for long underestimated, so continuing spreading knowledge and raising awareness is crucial. In our Breathe Vision, we aim to see positive changes in 2 main areas. The first is to establish new ways to better explore available resources and structures to increase awareness about lung health. Firstly, we need empowered patients who are our mouthpiece. By 2030, they should be integrated in policy developments, health technology assessments, and research to ensure high impact. Secondly, the lack of diagnosis, mis- and underdiagnosis, as well as the delays in receiving the right diagnosis, is still very common for lung diseases. We think that appropriate and comprehensive information should not only target the general public and the patients, but also healthcare professionals at different levels, so that they are better equipped to understand and identify these conditions. Finally, we need up-to-date available information to cover different aspects of the lung diseases, including the prevalence, the impact, the severity, and in many cases, the life-changing nature thereof. The other area is
Go ahead.
to address the other area is to address the stigma. We should overcome the negative perception of general public towards lung diseases. It is often considered that respiratory diseases are the result of self-harming activities, solely caused by tobacco and smoking. However, there are many lung diseases which are the result of gene mutations or bad air quality. In the case of my disease area, pulmonary hypertension, which is also known as PH, what causes it is still unknown. For example, pulmonary hypertension is a progressive lung disease that provokes breathlessness and dizziness. It is a rare and often misdiagnosed disease. 1 in 5 patients wait more than 2 years for the right diagnosis. At the European Umbrella Association of Pulmonary Hypertension, we started a series of awareness-raising events in 2012, which shortly became World Pulmonary Hypertension Day, celebrated every 5th of May. We partnered with sport events and raised the awareness of the disease with our branded t-shirts, materials that supporters and ambassadors proudly wear in various races. The main symptom of PH is breathlessness, which gave the idea how to bridge the disease to the general public. Sportswomen and sportsmen can feel the same tiredness at the finish line, which the PH patient need to cope with their everyday life, even during simple exercises like ironing or climbing the stairs. In addition, we participate in various TV, radio interviews, printed and online press with patient testimonies. We are happy that these efforts result in numerous phone calls and emails, and more people get to know about this often misdiagnosed disease. A lot has been accomplished. The EU Health Programme refers to the respiratory disease, but still, investment should be made to increase health literacy at all levels, to support capacity building of patients and their representativeness, to foster shared decision-making.
Excellent.
And government should be further strengthened to explore and address policy gaps and identify disease-specific issues. Thank you very much.
Thank you, Ujhelyi. You gave us a very extensive background on the different ways that you raise awareness and how important that is for your patient community, particularly those where, for a rare disease where a lack of awareness creates such a long problem for diagnostics. Let me now move to the next theme that we're going to be picking up, where we're going to be looking at the aspect of prevention, and Anne-Marie Baird from Lung Cancer Europe is going to be addressing that. So let me ask you, despite the fact that prevention is on everybody's lips, what does that really mean for lung diseases? Anne-Marie.
Hi, Tasman. Thanks very much for that. So I'll just keep it quite brief because I know we're under time pressure. So as we know, lung diseases account for 1 in 8 of all deaths in the EU, but only 3% of the health budget is spent on what are termed preventative measures. Therefore, to have meaningful strategies in this area, we must really increase funding and work together on multi-pronged risk reduction approaches and policy-making actions across the EU to really help reduce the numbers of people developing lung diseases, as well as improving the lives of those living with these diseases. Additionally, we need to work towards the realisation of the WHO European Immunisation Agenda to ensure access to appropriate vaccination infections such as those against tuberculosis. Those issues aside, we know that air pollution is a major cause of premature death and disease, and it is one of the largest environmental health risks we face here in Europe. We need to ensure that the EU air quality framework is implemented with effective air quality enforcement. Of course, tobacco use is also a huge factor, and we need to ensure really stringent regulation of all tobacco products, and that will have to include e-cigarettes and so on. We also must do more in educating the public around the risk factors for lung diseases and work to implement appropriate screening measures, for example, in lung cancer, and specific lung health checks for everybody. Lung disease really has to become an EU healthcare priority, Tamsin.
Thank you very much, Anne-Marie, and thank you for being very brief but clear, and your message, it has to become more of a priority. Let me now turn to the aspect of care, and Hilde de Keyser, the Chief Executive Officer for the Cystic Fibrosis Europe, is going to answer this one for us. So here's the point. In the vision, it says very clearly that care should be the right treatment at the right time. It's a very simple request from lung patients, but it's not actually happening. So what do you think needs to be done?
Thank you, Tamsin. It indeed seems a simple question. And when talking about the right treatment at the right time, we're talking about timely and accurate diagnosis, and Gergely already talked about that. And we're talking about access to appropriate high quality care. But on top of that, we're also talking to access to that all over Europe, available all over Europe. And the improvement in inequities, should be forged and monitored. As we know, today, access to appropriate care varies a lot between countries, even within the European Union. A major divide, yet not the only one, is between Western and Eastern European countries as a result of inequalities in access to health technologies and healthcare services, including workforce. Such a situation cannot be perpetuated any longer. Beyond its effects on human health, respiratory diseases bear an enormous economic burden on health systems, with the total cost reaching 380 billion per year in the EU. The Pharmaceutical Strategy for Europe promises that it will foster patient access to innovative and affordable medicines. It promises to deliver for patients and to ensure patients access to medicines. Within this context, we believe that there is an ample space for the EU to act decisively to improve access to high quality care. For example, by encouraging the transition to personalized care and tailored treatment plans, by promoting multidisciplinary care, by enabling active lives with highly protected patient rights, and by ensuring digital empowerment for better and more flexible disease management. We want to make sure that every European patient can have access to appropriate care by 2030, not on paper, but in real life. And if I may, Tamsin, I'll give an example from my own disease area. Because looking at the situation of people with CF in the different EU countries, we have been experiencing large inequities for a long, long time. Over the last decades, the life expectancy of people with CF improved a lot. We're very lucky. And CF is no longer a childhood disease in many countries. Most countries actually have more adult patients now with CF than pediatric patients. Yet in some European countries, still more than 90% of the patients are under 18. And this is due to lack of access to the right treatments at the right time. This shows large inequities within the European Union, and unfortunately, those inequities persisted also in recent years. They even got worse, maybe. And that is a bit of a contradiction. In a way, CF is a privileged disease. Over the last years, very innovative drugs were developed and came to the European market. Unfortunately, that didn't improve the situation for many European patients. These innovative drugs are very expensive, and the access is subject to difficult reimbursement negotiations. This is leading to situations where people are actually emigrating to another European country in order to have access to a certain medicine. This cannot possibly be the goal in a European Union that states it wants to prioritize unmet needs and ensure access to medicines to its population? Can it, Hansen?
Thank you. So Hilde, again, you made a very clear and very eloquent message about what care at the right time at the right place would look like and how it could be experienced for patients. And let's now talk. You've mentioned that cystic fibrosis has benefited from research and new developments and new drugs coming forward, but other parts of lung disease haven't. So now let's explore the research agenda. And here to give us some insight on that is Liam Galvin, the Chief Executive Officer of the European Idiopathic Pulmonary Fibrosis and Related Disorders Foundations. The question here is that the Lung Health Group is calling for a research agenda driven by patient priorities. What does this actually mean? What would these priorities be? Liam, go ahead.
I basically see Horizon 30 as the priority. It has the opportunity to build upon proven models like the European Reference Network, but it also can act as a catalyst for innovation and the sharing of best practice across the Union and beyond. Cross-border innovation and research must be fostered. Cooperation is vital. Duplication is just an unnecessary waste. The European Union has the resources to promote pan-European data collectives, registries and biobanks. All of these are a hugely unmet need, and they would provide a foundation for building research that would totally alter the respiratory environment. They could shape policies that would see air quality initiatives, new medications, patient pathways, and preventive measures rolling out. So for us and my patient community, research is a priority, and I think under the Horizon 2030 program and other EU programs, we can really improve lung health across Europe.
Thank you, Liam. Would you like to give us an additional specific example, or have you?
Yeah, I mean,
briefly.
For example, I represent a group of patients with lung diseases, with what causes scarring in their lungs. Counted together, these diseases take the lives of 50,000 Europeans each year. Our patients' numbers will soon be swelled by COVID-19 survivors suffering from lung scarring. However, within this 50,000, it belies the fact that improved treatments fostered by the EU Orphan Drug Programme have helped patients slow disease progression, maintain quality of life for longer, and ensure less hospitalizations for our patients. Hospitalizations that drain both the patient's quality of life, their energy, and the nation's health policy and budget. So there's priorities there what already exist. We just need more funding and an emphasis placed on lung health aspects.
Okay, thank you very much, Liam. You've given us really clarity about what this means for the patients on a day-to-day basis. And you mentioned that there are going to be more patients with lung scarring as a result of COVID-19, which gives me a good introduction to the final member of our panel, and that's Paul Summerfield, the chair of the Tuberculosis Europe Coalition. And he's going to give us some insight into just what we can expect with COVID-19. Paul, given the fact that we already have a very heavy disease burden from lung diseases, what do you think is the main lesson we should be drawing from the impact of COVID-19 for the long term? Paul, go ahead.
Tamsin, I think that in terms of the impact for the long term, let me put it this way. 10 days ago, I was happy at a personal level that as part of the British public programme, I received the first jab of the Pfizer vaccine. That was at a personal level, but I cannot help but reflect that the development that for COVID, we now in 9 months have reached the situation of having not just one, but several vaccines. Tuberculosis, my world, we have a rather feeble vaccine produced 100 years ago. This year is actually the centenary of the development of BCG, but it's not a very good vaccine. We haven't had the resources and the impetus to really make a change. just to take a look, though, at what has been happening with COVID, it is the big elephant in the room at the moment. For us in tuberculosis, first of all, we saw our machines disappearing. 4 or 5 years ago, a game changer in tuberculosis diagnosis was a PCR test. And that is now the primary test for COVID. And so many countries have moved the machines that were sitting in TB clinics to make them available for the COVID crisis. We also, of course, like many other diseases, lost our staff. Many nurses and doctors have been switched. They are lung physicians and lung clinicians, and so not surprisingly, they are helpful and for working with COVID and other lung disease. Net effect is estimates halfway through last year already, never mind taking into account the last 6 months of further lockdown, is that there will, over the next 5 years, be approximately 6 million more cases of tuberculosis than we would have hoped for, and there will be 1.5 million more deaths as a result of tuberculosis. That compares with the situation that today COVID has killed 2 million people. But 1.5 million extra from tuberculosis is no small extra story. There is some small silver lining that the COVID exercise has created an impetus for the use of digital tools for TB diagnosis and patient care. The research will probably have some useful spin-offs for TB as well. But it's also shown that civil society organizations in TB can be helpful in getting rid of, in reaching the difficult to get to communities. One particular example would be in Tajikistan, one of the most mountainous countries in the world, one of the poorest within the WHO Europe region. Yet it has one of the best and most effective TB survivor-led civil society organizations. And also it's interesting that initiative I was involved in last month, talking with people in the Ministry of Health and National TB Program, it is clear they are still trying to maintain priority for TB action, but with difficulty. The Stop TB partnership in Tajikistan, the patient-led group that I mentioned, they've been involved in the provision of PPE, they've been distributing information material, they have been training other significant groups, particularly they've trained some 850 imams on what is COVID, what is TB. Showing that patient groups can play a very helpful and significant role in health emergencies. So my closing statement really is a great wish for further resources for research into both tuberculosis and other health diseases, other lung diseases. Thank you.
Thank you very much, Paul, for sharing that. And you do give us some context that we may be looking at 2 million COVID deaths, but the diversion of resources and focus has led to a sort of a wave of other deaths that we're going to be seeing from other diseases such as TB and cancer and other untreated conditions coming in the months and years to come. So huge impact on us, but also giving us some insight about where the positive aspects are of being able to build and strengthen our health systems. We're running very late in our program, so there's not a lot of time, but this is an opportunity to pick up some questions and interventions from the audience. And just before I do that, I'd like to go back to Anne-Marie Baird, who was one of my panelists, because we'd like to get her to give an example from the area of prevention and how that would work. And then I'm going to take a couple of questions from the audience if we have that. Anne-Marie, go ahead.
Oh, thanks very much, Tamsin. So my specific disease area is lung cancer. And so when the term prevention is used in this disease, it tends to lull people into a false belief that they have to be an active smoker to develop lung cancer. And we know that's not the case. So therefore, for us, we feel risk reduction is a more appropriate term. And we educate on all risk factors, environmental, exposure to pollution, radon, and so on, with also an emphasis on symptom recognition. So for example, if we look at radon, exposure is linked to approximately 10% of all lung cancer cases in the EU, yet not many people are aware of what radon is. So we hope that the European Beating Cancer Action Plan will truly address these issues, as they really require coherent, cross-cutting policies. And we know for some that there's also a lack of awareness that certain inflammatory diseases, such as chronic obstructive pulmonary disease, can increase the risk in developing lung cancer, even in the absence of smoking. However, people aren't really aware of that either. So in fact, if you look at non-smoking related lung cancer at a separate entity, it actually still ranks in the top 10 for all cancer related deaths globally. So really, as well as increasing education and awareness, we're advocating for the implementation of lung cancer screening in high-risk individuals, as this is one of our best opportunities to see a stage shift in lung cancer diagnosis, which of course will mean better outcomes for people impacted by this disease. Thanks,
Great.
Nancy.
Thank you very much, Anne-Marie. I'm now going to open up to see if we've got questions or comments coming in from the audience to the members of our panel. And we do have one question that I'm going to be picking up from Frank Willisin from Alpha One Plus in Belgium. Frank's question is going to be going to Georgi Michaelos, and it's about the question of awareness. And his question is, as a patient and patient representatives from a rare genetic condition in which 95% of patients in Europe are unknown, how do you think it's possible to sensitize the majority of the population with respiratory problems, to empower them to ask for their rights, to know about their disease, and even shorten the time of diagnostics? So Gergely, let me come back. Here's a question. If you have a disease that's very rare, and the vast majority of people don't know about it, but they've got some respiratory symptoms, how do we empower them?
Thank you very much, Frank, for this.
You're on mute, Gergely. You've swapped the microphone for the camera. Now we should be able to hear you.
Yeah, so thank you very much for this question, Frank. It is a very complex one, so I think that I would rather ask how we can address this. Regarding, diagnosis in delays, I think that there are lots of activities we can build on. For instance, last year within European Reference Network, we elaborated in case of many diseases, patient journeys, where we see from the very first symptoms until the cure or the management. And that point, we identify different hurdles. So once there's a first symptoms and trying to get the appropriate diagnosis, probably a good way in terms of raising awareness can be that in general practitioners, for instance, or cardiologist or pulmonologist received any specialized tailor-made lectures from their society in terms of their annual meetings. So we hope that that way we could raise awareness of very rare lung diseases in the GPs, general practitioners, who can further on refer those patients to expert centers where they can get the appropriate diagnosis. I think that, for instance, with this way, we can shorten the time for the appropriate diagnosis. In terms of raising awareness, I think that we provided some nice examples from our specific disease that we try to find the appropriate and voice and a linkage how we can address the general public with this. I think, I know that we are a little bit late, but I think that these are the ideas we can build on. We have lots of examples how patients can be empowered, for instance, in health technology assessment, in trials of the committees, in different discussions when we are forming the policies. So there are ways actually which is working now, but we put more pressure on it and make it better in the future.
Thank you. Thank you, Gergely, and thank you, Frank, for posing the question. As I said, we are very late, and I do hope our final speakers are able to stay with us if we run over 5 or 10 minutes, because we have a few questions that I'd like to see if we can get an answer to. We've had a question being raised that is looking at the question of what we can do on research. So Krishna Poisanani from the Asthma UK and British Lung Foundation has a question. How do we best influence Horizon Europe, and essentially that's EU research programs? What can we do to ensure that lung disease gets the best focus? And perhaps this is Thierry and Liam might like to respond on this.
Yeah, thanks for that. I think that's an excellent question, and it taps into to awareness and making sure that that everybody is well aware of the importance of respiratory diseases and the fact that there is some underfunding there. So in addition, I think it's important to also make sure that the outputs that we generate from the respiratory field in terms of the use of European funds is well known. For example, the vaccine development has been partly funded with EU funds long before the COVID pandemic hit us. So it's really due to these programs, or based on these programs, that also for respiratory diseases we can find solutions when the time is right. And I think this needs to be well known by people, and we need to acknowledge that the respiratory problems really are a big part of non-communicable diseases, and hence deserve the funding, because one day a problem hits us, and then we are better prepared, of course, if we can have that funding ready. Okay. Research is something that is done very slowly, so it requires consistent funds in order to really build a program and come up with results. But disseminating these results also to patients and stakeholders is key here.
Okay. Thank you very much. Look, I think it's best if I move on with our program, because time is running away. We still have a few speakers who need to share their views. Just say thank you for everyone who has submitted their questions, and to the speakers who've come forward so far. I also note that we've got some lively exchange happening on social media using the hashtags. So this is another way you can keep this conversation going. Let me now move to the next element in our agenda, where I'm going to invite our next speaker, and I'd like to invite Kield Hansen to share some points from the European Lung Foundation.
Yeah, so thank you very much, Tamsin, and thank you very much to all our speakers for providing these excellent examples, and of course also to all the great questions that we got. So I would like to first and foremost highlight and appreciate all the diverse and supplementary experience and expertise that is represented in the room. I really think and believe that this will help us to ensure that lung health remains both in the spotlight, but also that it's possible to build good solutions to move forward. And I think many of our speakers contributed so excellently to that point by giving their examples and showing their story, sharing their stories. I would also like to emphasize the efforts made to collaborate and to work together across European level, respiratory patient and professional groups, and with other stakeholders, which we have experienced through the development of the brief vision. So I think that we have had a great start in the European Lung Health Group, and I would like also to extend an invitation then to reach out to us regarding the advancement of this important work. So thank you to everyone who joined and participated in this event. I think your interest and your support is so highly appreciated, and you are really the key for us to be able to move this work forward. And then lastly, I would like to thank, of course, our keynote speakers and to the Lung Health MEP group for hosting the events, which will make, which we hope will help to ensure a better lung health future is achieved. And we know that there is an ambition to do so. We hope that the brief vision paper will make a great point of departure for further collaboration. And then to just quote our keynote speaker, Pierre Delsaux, having a plan is important, but implementing it is more important. So thank you.
Thank you very much, Kjeld. This is very useful, and as you said, we've had some great interventions so far, which have really highlighted the different aspects of lung health and why we need to be moving forward. To now give our final closing remarks, I'd like to return to MEP Željana Zovko, and we'll have another MEP after that, Sean Kelly. So Željana, you've heard an amazing range of speakers. You've heard patients and professionals all coming together saying why lung health needs greater focus and attention, and lots of ambition set out in this vision that we hope the EU can step up and meet. Željana.
Right, thank you very much. I heard really wonderful speakers, and this was, and I congratulate to all of you for your real precious contribution, and we will try to see how to incorporate this into our work as well towards making much stronger policies in this issue. So I'm going to read you my speaking remarks in order to conclude this very, very good meeting as always, dear Tamsin. So I would like to thank all the speakers for their contribution to this event. We heard some very interesting statements and a lot of food for thought for future sessions. Over the last year, we have learned that with the right will and the necessary means, we can provide solutions to medical questions that are going to have to bear fruit. I believe that by transposing the COVID approach to other respiratory diseases and by investing our efforts in the actions proposed in the Breath Vision 2030 paper, we could reach very far. Building on the recently established EU for Health program is the first step. Establishing upgraded screening system is another. As a Croatian, I am particularly proud of my country, as it is the first EU member state that introduced a nationwide screening for early lung cancer detection. Our government invested in the necessary equipment across the country in order to conduct these tests. I sincerely hope that other countries will follow this example for the benefit and health of their citizens. How unfortunate the COVID crisis was, it also served as a stimulus for specific progress at European level. The EU started working on a European Health Union that will allow member states to respond to health crises together, to improve prevention, treatment, and aftercare for diseases such as cancer. For the first time, we also built a stockpile of medical supplies that can be distributed by the Commission through the valuable RESC-EU program. Nonetheless, it goes without saying that a lot of work lies ahead of us. The paper discussed today gives an excellent overview of where we need to focus on. With the MEP Lung Health Group, we will take the necessary steps to realize these objectives. We started the decade with a massive health crisis. Let's finish this decade with a common European approach, providing support and solutions for respiratory and other diseases. Let's end the decade much healthier and resilient. Thank you very much.
Thank you very much, Željana, and what a lovely vision for us to think about, you know, within 10 years to have moved from a position of vulnerability and problems to a point where we're healthier and we could breathe better. Let me now invite MEP Sean Kelly, thank you for joining us, to also share some final words.
You're most welcome. Good morning, everyone. I'm very happy to be here to support the launch of the Breath Vision paper. And let me begin by thanking the European Respiratory Society for asking me to speak at such an important event. I would like also to thank our respected panelists for their knowledgeable contributions to today's discussion. As Željana said, they were excellent. I really enjoyed them and learned a lot. COVID-19 has certainly highlighted the health inequalities in our society, as those among us who are dealing with underlying conditions such as respiratory problems are at a much greater risk. Most people who get sick with COVID-19 develop mild to moderate respiratory symptoms. However, those who live with lung diseases like chronic obstructive pulmonary disease, asthma, pulmonary fibrosis and lung cancer, while not more likely to get the COVID-19 virus, are at greater risk of serious illness if infected. And indeed, I know some colleagues and friends of mine who unfortunately passed away as a result. Although breathing is an involuntary function that we may take for granted when thinking of our overall health, the current pandemic has highlighted vulnerabilities in the health of society. Because COVID-19 has had such a profound impact on the respiratory community, it is imperative that policymakers and national governments ensure that all frontline workers, as well as people of all ages living with lung conditions, are prioritised in national vaccine rollout plans. The COVID-19 crisis has also hindered the essential healthcare services related to lungs. In my own member state, Ireland, there are warnings of the huge backlog of untreated respiratory patients as the health service grapples with COVID-19 cases. However, COVID-19 has highlighted the importance of respiratory health, which presents the opportunity to bring unmet needs to the attention of the new European Health Union. Such a health union would create a more coordinated and efficient response to future health crises by ensuring medical supplies are available, improving prevention, treatment and aftercare for diseases. This will improve resilience in our health systems and better address future pandemics. The increased awareness has created a call to invest in research, which Thierry mentioned, and we should take advantage of it through funding programs and be reflected in policy changes. The benefits of European investment into research speak for themselves when we take into account the swift production of COVID-19 vaccines. We won't refer to AstraZeneca. Better international coordination on respiratory viruses and infections should be the result. To further advocate for patients suffering with chronic and infectious respiratory diseases and promote a greater understanding of respiratory health, I was pleased to hear of the formal launch of the MEP Lung Health Group last October. This will help to advocate and also help to get funding through Horizon Europe. The Parliament Special Committee on Beating Cancer also works closely with lung health and aims to strengthen the approach at every key stage of the disease: prevention, diagnosis, treatment. Life is a cancer survivor and palliative care, ensuring a close link with the research mission on cancer in the Horizon Europe programme. There is much still to be done in this area, but I wish every success to those involved in the Breathe Vision paper in their endeavour to increase awareness of respiratory health, improve lung health care and research, and tackle COVID-19 and its long-term impacts in Europe. To conclude, I would like to thank everyone for joining us here today. I would like to thank Europe Respiratory Society for organising this virtual launch and to wish everybody well. And as my colleague and friend Željana said, a lot of work lies ahead of us, but we now know where to focus. Thank you very much indeed.
Thank you very much, Sean. And it's so positive to have strong messages from the European Parliament that they're interested in being our partner in working towards the Breathe Vision document and making sure that, as you said, we've now got a clear pathway about where to go. And it's useful to have this partnership between clinicians, patients and politicians. That's the only way that change happens. And at the beginning of the decade, this is great to have such a strong message of support. Thank you all for having participated. Let me now, and I realize that we ran on a little bit longer, but I hope you found it useful. Well, let's just ask you, the audience, how you experienced this different experience. And here you've got the link to the Breathe Vision website. This is open for endorsement. So please go on there, endorse it with your organization. You'll also please keep the conversation going. You've got the hashtags, but tell us how you experienced this event. Was it good, excellent, average, anything that we could do? Please give us a vote, because we want this to be one of an activity that delivered real value for you. We heard it was an opportunity to create a partnership with the MEP Lung Health Group, and they're committed to seeing how they can be the partner within the Parliament to put pressure on the Commission and make sure that we're working towards this. And it's clear that when the Commission launches their big plans and their big proposals, that this pathway that you've set out in Breathe 2030, it's an opportunity to feed that in and ensure that it's clear, if you want to have an impact on lung health, this is what needs to happen. So again, here is the website, and we are looking for other organizations to share this vision, to endorse it, and to disseminate it widely, either at national or European level. We mentioned at the beginning there will be a report from this event, and this recording will be available on the Breathe Vision website. So if you want to go over and re-listen to some of the useful inputs, you're welcome to do this, and you can share it with colleagues and friends. Thank you very much, everyone. And let's have a quick look at the results of the poll, how people felt about this seminar. And this is fantastic. We've got 40% said it was good and 47% said it was excellent. So we've clearly met people's needs in understanding what the opportunities are moving forward at European level, and the vision document about where we could be understanding everything. So thank you everyone, to our speakers, to our participants, the technicians behind the scenes, and the EFA and ERS teams, without whom this event would not have been possible. We thank you for your patience and your time staying with us, even though we ran a little bit over. We hope you stay safe, be well, and we look forward to collaborating with you in the coming months and years to achieve the Breathe vision for 2030. Thank you and goodbye.